Have you been told that your blood pressure should always be 120 over 80, no matter your age? What if that advice isn't the full story? Millions of adults over 65 worry every time they see a blood pressure reading above 120, while others assume higher numbers are simply a normal part of aging. But according to modern medical research, the answer is much more complicated, and it may surprise you. In fact, trying to push blood pressure too low isn't always better, especially for older adults. The ideal blood pressure after 65 depends on your overall health, medical history, medications, and how your body responds to treatment. Understanding what those numbers really mean could help you avoid unnecessary worry, have better conversations with your doctor, and even reduce your risk of heart attack, stroke, kidney disease, and falls. Stay with us because by the end of this video, you'll understand what many people misunderstand about blood pressure after 65 and why the perfect number isn't exactly what most people think. Blood pressure is one of the most important measurements of your overall health because it reflects how hard your heart must work to pump blood throughout your body. Every time your heart beats, it pushes blood through a network of arteries that deliver oxygen and nutrients to every organ. The top number, called systolic blood pressure, measures the pressure when the heart contracts. The bottom number, known as diastolic blood pressure, measures the pressure while the heart relaxes between beats. Together, these two numbers provide valuable information about your cardiovascular system. For many years, people believed that blood pressure naturally had to rise with age and that little could be done about it. While it's true that arteries gradually become less flexible over time, doctors now know that consistently high blood pressure is not simply a harmless part of getting older. High blood pressure remains one of the leading risk factors for heart disease, stroke, heart failure, kidney disease, and vision problems. Because high blood pressure often causes no symptoms, it has earned the nickname the silent killer. This is where many people become confused. They hear that the ideal blood pressure is 120 over 80 and assume everyone over 65 should reach exactly that number. In reality, many healthcare organizations recommend individualized treatment goals for older adults. While many healthy adults may benefit from keeping systolic blood pressure below 130 millimeters of mercury, the safest target often depends on the person's overall condition. A healthy, active 68-year-old may have a different goal than an 88-year-old with multiple chronic illnesses or someone who experiences dizziness when standing. One reason for this individualized approach is that lowering blood pressure too aggressively can sometimes create new problems. Blood pressure that falls too low may reduce blood flow to the brain, increasing the risk of dizziness, fainting, or falls. Falls are a major cause of injury among older adults, and healthcare providers carefully balance the benefits of lowering blood pressure against the possibility of unwanted side effects. This doesn't mean high blood pressure should be ignored. Instead, it highlights the importance of finding the right range for each individual rather than chasing one universal number. Research over the past decade has shown that carefully controlling blood pressure can significantly reduce the risk of stroke and cardiovascular disease in many older adults. However, these benefits are greatest when treatment is personalized. Doctors consider factors such as diabetes, kidney disease, previous heart attacks, history of stroke, medication tolerance, and overall physical function before recommending specific blood pressure goals. Another important fact is that one blood pressure reading tells only a small part of the story. Blood pressure naturally changes throughout the day. It rises during physical activity, emotional stress, excitement, and even conversations. It usually falls during sleep and may temporarily increase after drinking coffee or climbing stairs. Because of these normal fluctuations, doctors rarely make treatment decisions based on a single reading. Instead, they look for consistent patterns over days or weeks. Many people also experience what is known as white coat hypertension. Simply visiting a doctor's office can create anxiety that temporarily raises blood pressure. In contrast, some people have normal readings in the clinic but elevated blood pressure at home, a condition called masked hypertension. This is why home blood pressure monitoring has become an important tool. Measuring blood pressure under relaxed conditions provides a more complete picture of how your cardiovascular system performs during everyday life. Proper technique is equally important. Crossing your legs, talking during the measurement, using the wrong cuff size, or checking blood pressure immediately after walking can all produce misleading results. Ideally, you should sit quietly for several minutes with your back supported, feet flat on the floor, and your arm resting at heart level before taking a reading. Even small improvements in technique can produce more accurate numbers and reduce unnecessary concern. Many older adults become worried when they notice the top number slowly increasing with age while the bottom number remains relatively stable or even decreases. This pattern, known as isolated systolic hypertension, becomes more common because arteries naturally become stiffer over time. Although it should not be ignored, it is also one of the most common blood pressure patterns seen in people over 65. Fortunately, lifestyle improvements and, when appropriate, medication can often help manage it effectively. Lifestyle continues to play a remarkably powerful role in blood pressure control, regardless of age. A heart-healthy eating pattern, rich in vegetables, fruits, whole grains, beans, nuts, fish, and lean proteins, provides nutrients that support healthy blood vessels. Reducing excess sodium while increasing foods naturally rich in potassium, when appropriate, may help many people maintain healthier blood pressure. Regular physical activity, maintaining a healthy weight, getting adequate sleep, managing stress, and avoiding tobacco all contribute to healthier circulation. One of the biggest misconceptions is that medication alone is enough. While blood pressure medicines save countless lives, they work best when combined with healthy daily habits. Small improvements practiced consistently often produce meaningful benefits over time. Even modest reductions in blood pressure can significantly lower the long-term risk of stroke and heart disease. Hydration is another factor that deserves attention, especially after age 65. Some older adults intentionally drink very little water because they worry about frequent urination. However, dehydration may contribute to low blood pressure, dizziness, and reduced circulation. Finding a healthy balance between staying hydrated and managing bladder symptoms is important for overall cardiovascular health. Sleep quality also affects blood pressure more than many people realize. Poor sleep, untreated sleep apnea, and chronic insomnia can all contribute to elevated blood pressure over time. People who snore loudly, stop breathing during sleep, or wake feeling exhausted may benefit from discussing these symptoms with their healthcare provider, because treating sleep disorders often improves overall heart health as well. Stress cannot be ignored either. Although short periods of stress naturally raise blood pressure, long-term stress may encourage unhealthy habits such as overeating, inactivity, smoking, or excessive alcohol consumption. Finding healthy ways to relax supports not only emotional well-being but cardiovascular health as well. Perhaps the most surprising lesson is that the ideal blood pressure after 65 is rarely about achieving one perfect number. Instead, it's about reaching a level that reduces the risk of heart attack, stroke, and kidney disease while allowing you to stay active, independent, and free from side effects such as dizziness or falls. That balance is different for every individual, which is why regular medical follow-up remains so important. Understanding your blood pressure empowers you to make informed decisions rather than reacting to isolated numbers. The goal isn't perfection. The goal is protecting your heart, brain, kidneys, and quality of life for years to come. When you understand what those two numbers truly represent, they become more than just figures on a monitor. They become valuable tools for supporting healthy aging. As we get older, our blood vessels naturally lose some of their flexibility. When we're young, the walls of our arteries expand easily with each heartbeat, helping blood flow smoothly throughout the body. Over time, those arteries gradually become stiffer. This is one of the main reasons the top blood pressure number, known as systolic pressure, often rises with age. While this change is common, it doesn't mean it should simply be ignored. Healthy lifestyle habits and proper medical care can still make a meaningful difference, even well into your 70s, 80s, and beyond. One question many people ask is, if my blood pressure is a little high but I feel perfectly fine, do I really need to worry? The answer may surprise you. High blood pressure rarely causes symptoms until serious damage has already occurred. Your heart, brain, kidneys, and eyes can be affected for years without causing pain or discomfort. That's why regular monitoring is so important. Feeling healthy does not always mean your blood pressure is under control. Your heart works continuously every minute of every day. When blood pressure stays elevated for months or years, the heart must pump against greater resistance. Eventually, the heart muscle may become thicker and less efficient. This increases the risk of heart failure, irregular heart rhythms, and other cardiovascular problems. Keeping blood pressure within a healthy range reduces this extra workload and helps the heart function more efficiently over time. The brain is equally sensitive to blood pressure. High blood pressure is one of the leading causes of stroke, because it weakens and damages blood vessels that supply oxygen to brain tissue. Even when a stroke never occurs, years of poorly controlled blood pressure may contribute to tiny areas of damage inside the brain that affect memory, thinking, and balance. Protecting your blood pressure today is also an investment in maintaining your independence and mental sharpness in the years ahead. Your kidneys are another important organ that depends on healthy circulation. These remarkable organs filter waste products from your blood every minute. High blood pressure can gradually damage the tiny blood vessels inside the kidneys, making it harder for them to perform this essential job. As kidney function declines, blood pressure often becomes even harder to control, creating a cycle that can continue unless it is properly managed. The eyes also contain extremely delicate blood vessels. Over time, uncontrolled hypertension can damage these vessels, increasing the risk of vision problems. Because the eyes provide a direct view of blood vessels without surgery, eye examinations sometimes reveal signs of high blood pressure before other symptoms appear. This is another reason regular medical checkups remain important throughout life. One of the biggest mistakes people make is checking their blood pressure only when they feel unwell. Blood pressure management is most effective when it becomes part of a routine. Many healthcare providers recommend measuring it at approximately the same time each day under similar conditions. Looking at trends over several weeks gives a much more accurate picture than focusing on one unusually high or low reading. Morning blood pressure often receives special attention because many heart attacks and strokes occur during the early hours of the day. Blood pressure naturally begins rising shortly before waking as the body prepares for activity. For some individuals, this increase becomes much larger than normal. Tracking morning readings at home may provide valuable information that helps healthcare providers decide whether treatment adjustments are necessary. Many people become alarmed when they occasionally see a reading that is higher than usual. Perhaps they had a stressful phone call, rushed up the stairs, or drank several cups of coffee. Temporary increases are completely normal. The important question is whether blood pressure remains consistently elevated over time. One isolated reading should never cause panic, but repeated high readings deserve medical attention. The opposite situation can also occur. Some older adults experience blood pressure that drops too much after standing up from a chair or getting out of bed. This condition, called orthostatic hypotension, may cause dizziness, blurred vision, weakness, or even fainting. It becomes more common with age and can sometimes result from dehydration or blood pressure medications. Healthcare providers often check blood pressure while sitting and again after standing to identify this problem because preventing falls is just as important as lowering blood pressure. Nutrition remains one of the most powerful tools for supporting healthy blood pressure. Vegetables provide potassium, magnesium, antioxidants, and fiber that support healthy blood vessel function. Fruits contribute vitamins and natural compounds that help reduce inflammation. Whole grains provide steady energy while supporting healthy cholesterol levels. Beans and lentils offer both protein and fiber, making them excellent choices for heart health. Reducing excess sodium remains one of the most effective dietary changes. Much of the sodium people consume comes not from the salt shaker, but from processed foods such as canned soups, frozen dinners, deli meats, packaged snacks, sauces, and restaurant meals. Reading food labels carefully often reveals surprisingly large amounts of hidden sodium. Choosing fresh foods more often allows better control over total salt intake without sacrificing flavor. Physical activity is another key factor. Exercise helps the heart become stronger and more efficient, allowing it to pump blood with less effort. Walking, swimming, cycling, gardening, dancing, or other enjoyable activities all support healthier circulation. The goal is consistency rather than intensity. Even moderate activity performed regularly can produce meaningful improvements in blood pressure and overall cardiovascular health. Maintaining a healthy body weight also reduces strain on the heart. Excess weight requires the heart to pump blood through additional tissue, increasing its workload. Gradual weight loss achieved through balanced nutrition and regular movement often leads to measurable improvements in blood pressure, while also lowering the risk of diabetes and heart disease. Smoking remains one of the most damaging habits for blood vessels. Every cigarette exposes arteries to chemicals that promote inflammation and narrowing of blood vessels. Even after years of smoking, quitting allows the body to begin repairing some of this damage. The benefits start almost immediately and continue growing over time. Alcohol deserves careful attention as well. While moderate intake may fit into some people's lifestyles, excessive alcohol consumption can raise blood pressure and interfere with certain medications. Understanding your personal limits and following medical advice helps reduce unnecessary cardiovascular risks. Medication plays an important role for millions of older adults. Today's blood pressure medicines work in different ways. Some help blood vessels relax, others reduce excess fluid, while others slow the heart or block hormones that raise blood pressure. Finding the right medication sometimes requires patience because every person's body responds differently. It is not unusual for doctors to adjust doses or combine medications to achieve the best balance between effectiveness and minimizing side effects. One common mistake is stopping medication as soon as blood pressure improves. In many cases, the medication is the reason the numbers improved in the first place. Suddenly, stopping treatment may allow blood pressure to rise again, increasing the risk of serious complications. Any medication changes should always be made under the guidance of a healthcare professional. Another important point is that blood pressure goals may change over time. As people age or develop new medical conditions, healthcare providers sometimes adjust treatment plans to reflect changing needs. What was considered the best target at age 65 may not necessarily be the ideal goal at age 85. This is why ongoing medical follow-up remains an essential part of healthy aging. Perhaps the greatest surprise is that healthy aging isn't about chasing the lowest blood pressure possible. It's about maintaining a level that protects the heart, brain, kidneys, and blood vessels while allowing you to feel energetic, steady on your feet, and able to enjoy daily life. The healthiest number is often the one that keeps you safe without causing dizziness, weakness, or unnecessary side effects. Understanding these principles allows you to see blood pressure differently. Instead of fearing every number that appears on the screen, you begin to understand the bigger picture. Blood pressure is not simply a score to judge your health. It is a valuable signal that helps guide decisions designed to protect your body for years to come.